Every decision inside an ablation procedure is based on the electrical function of the heart, and the signals represent that electrical function. I'm Zachary Koch, Principal Product Advisor for BioSig Technologies. My job is to develop software and optimize the hardware for pure EP. A lot of the challenges that physicians deal with on a daily basis relate to signal quality and signal clarity. Every decision that a physician makes in a surgery may impact as much as a millimeter or centimeter of tissue. And to make those decisions with a high degree of accuracy, you need to make sure that the data that you're using to inform your decisions is clear and presented accurately and with a high degree of specificity. What we've done is enhance the quality of the data that's presented to the physician on a beat-by-beat basis so that they can see the problem clearly and interact with that patient at a much higher level. The less time that a patient spends on the table, the less expensive that procedure will be for both the patient and the hospital. And I would say that Pure EP is the only technology in the space of case efficiency. The research data recently published by the Cleveland Clinic showed some very important efficiency improvements in treating atrial fibrillation if you're using a signal-based approach that is responsive to tissue through Pure EP. When you're listening to the tissue and you're measuring the response based on the unipolar electrogram, you can dramatically focus therapy and reduce therapeutic time for each individual lesion by 66%. Without being critical of ablation index, because it is a clinically validated gold standard, its primary limitation is focused predominantly on the dose of therapy being delivered. It's not currently paying attention to the response to that therapy. Where Pure EP fills in the gap and complements ablation index is that we are focused primarily on the response to therapy at each individual location. And when you do that, you realize that the tissue response actually happens much sooner than the ablation index would suggest. And we could potentially significantly reduce procedure time by trimming the excess time off each individual therapy. We're an ambitious company. We have an ambitious vision. We consider ourselves to be physician advocates first. And so we continue to focus on the ever-evolving needs of the physician as EP gets new technology and new workflows and new approaches, making sure that the physician is constantly supported and surrounded by the right technology, the right applications, and the right data, knowing that if we support them, that they will do a better job for the patient.